Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today's episode: the heart stops, cardiac arrest in the young and apparently healthy. Shocking, isn't it? Healthy young adults, fit, vibrant, seemingly indestructible, dropping without a warning. Let's dive into the numbers, the mystery, and the medical opportunities. Further reading out a recent review in JAMA, published on February 2025, titled Out of Hospital Cardiac Arrest in Apparently Healthy Young Adults. Another source, Cardiac Arrest versus Heart Attack, an opinion piece co-authored by me at the Ohio State University website. The scope of the problem: every year, 350,000 to 450,000 Americans suffer out of hospital cardiac arrest. About 6% of these are under 40. Among them, 60% never make it to the hospital. Of those who do, only 9 to 16% survive to discharge. But here's the twist: 90% of survivors leave with intact brains, life saved, not just prolonged. The usual and the unusual suspects: cardiac causes dominate, 55 to 69% are cardiac causes, including coronary artery disease, cardiomyopathy, sudden arrhythmic death syndrome or SADS. Non-cardiac causes: opioid overdose, pulmonary embolism, subarachnoid hemorrhage, seizures, and infections. The hidden red flags: these aren't all athletes with pristine EKGs. They just didn't drop dead. They were primed unknowingly for disaster. Despite appearing healthy, 65 to 78% had risk factors, including hypertension, diabetes, tobacco, smoking, obesity, dyslipidemia. Apparently healthy often means undiagnosed risk. Resuscitation and the road ahead: after the return of spontaneous circulation, start with a 12-lead EKG, then toss in the cardiac troponins, electrolytes, and urine tox screen. Do a CT head to pelvis, a bedside ultrasound. Still no answer. Consider detailed echocardiography, cardiac MRI, EP study, genetic testing. Test the family tree, it could be an essential clue. ICD indications: if the heart damage is irreversible, or if an electrical storm brews unseen, an ICD is the lifeline, particularly in non-reversible cardiac causes, structural heart disease, inherited cardiac arrhythmia syndromes, and subcutaneous ICD if pacing is not needed. Treat reversible causes for Brugada, for ventricular tachycardia, long QT syndrome, where lifestyle changes, beta blockers, and maybe a subcutaneous ICD. And if it was an opioid overdose or a QT prolonged drug, treat the cause, no ICD needed. Tailored intervention: avoid QT prolonging medications and supplements, stimulants, and high stress exercise. Treatment options include beta blockers, amiodarone, catheter ablation, cardiac surgery for coronary anomalies, and counseling for substance misuse or epilepsy. The genetic breadcrumbs: genetic testing helps survivors and their kin. Who and why? The diagnostic yield in survivors is 2 to 22%. In those with sudden arrhythmic death syndrome, it's as high as 13 to 34%. First degree relatives may harbor latent genetic risks. Family screening can save silent carriers. Sometimes you don't treat the patient, you protect the family too. After the storm, 10-year survival is greater than 90% in survivors under the age of 40. There's about a 15% risk of recurrence or death within the first year, up to 37% recurrence of ventricular arrhythmias post ICD, and they may have ICD shocks in 2 years, 37%. Lifelong monitoring and care is therefore needed. Closing thoughts: early bystander CPR and defibrillator use dramatically improve survival. Outside hospital cardiac arrest is not rare in young adults. Several celebrities have had it, and often not truly healthy. Outside hospital cardiac arrest in the young is a warning sign, a signal. It's not random. They have underlying risks. It's a red flag flapping in the silence. And for those who survive, it's a second chance if we look closely enough. Survivors need comprehensive workup and long-term care.